This is going to be a video on the important fields to hit in ESO when it comes to the transport of an acutely intubated ventilator patient. So first of all, we'll start with your ventilator settings. Ventilator settings should be in the flow chart in ESO and not in the narrative. When you go into ESO, you're going to go into the flow chart and select airway, then ventilator, and then you'll come up with your ventilator screen here. The only thing that I think you might be confused about is going to be the mode of the ventilator, because there's a lot of abbreviations in here that may seem confusing. So assist control volume, assist control pressure control. Basically, this is either pressure cycled breaths or volume cycled breaths. Generally, adults are always going to be on tidal volume, so that would be AC volume, or you would have SIMV, volume control pressure support. Okay. All these other acronyms in here are not important. Just make sure that you get the right one selected. And all your other vent settings, ventilation rate, PEEP, tidal volume, inspiratory time, and FiO2, or your oxygen concentration, those are all in there. If you don't have a field, if you don't have a number like Hertz or the chest wiggle factor here, then don't worry about it. Just include your 6 ventilator settings. Next, we want to cover our ET tube. Okay, ET tubes should be documented, and the placement should be measured at the lip line and documented, and then that also should be in your narrative. When you hand the patient over, you're going to document the ET tube was still at the same spot that you documented it at when you pick the patient up. Another really important thing when it comes to documenting your ET tube is in your vital signs, you should have an end-tidal CO2. Okay, end-tidal CO2 is now the gold standard per protocol to always have on your patient when they have an advanced airway, to confirm that advanced airway is in place. So you should have continuous end-tidal CO2 monitoring documented in your vital signs. Now, if the doctor gives you an order, a medication order, to take some action if the patient's blood pressure drops too low, or if the patient begins to wake up or whatever, this can be a verbal order or this can be a written order. Now, written orders are great, but physicians aren't always in the habit of doing that for us. They may just tell us, hey, I'm going to give you a verbal order and that's good enough, but just make sure that's documented in your narrative. So in this case, I have a patient who got versed as they began to wake up. You can see my vital signs. This patient was under the entire time, but they began to wake up. So I had a verbal order to give, a written order rather, to give versed, and I documented that in the medication section. All of the medications that are hanging on the patient when you get there that will be going along with the patient to the receiving hospital should be documented again in your flow chart. Any medications that the patient is receiving via IV pump that will be traveling with the patient to the receiving facility should be documented in the flow chart as well. The sending or the transferring physician is always the best person to contact, and that's why it's very helpful to get the doctor's phone number so you can directly contact the doctor if there's any kind of hiccups en route. In this case, this patient is in septic shock. They're on both norepinephrine and vasopressin, and at one point my blood pressure began to drop, so I made the call and I got a consult here. I documented. I consulted with Dr. Mackey and got the medication increased, the norepinephrine increased, and corrected that blood pressure. Vital signs are very important to document, especially if you have a patient that's on any kind of medications that are going to be affecting the blood pressure or the heart rate or the heart rhythm. The rule is on a transfer, 1 set of vital signs every 15 minutes, minimum 2 sets on the patient. If you have a patient who's in any kind of critical condition or unstable condition, then you need to be monitoring vital signs a lot more often. Finally, in the narrative section, you need to make sure that you are covering anything that happened outside of the norm. If there were any, interventions you had to do during the transport, if you had to address any kind of alarm on the ventilator, make any adjustments on the ventilator, any kind of contact you had with the sending physician or with medical control, that should all be included in your narrative section as well. And that's how you document a ventilator transport.